Good afternoon, everyone. This is Michele Hughes from Ageless and Timeless. Today, I have a wonderful guest named Dr. Kent Holtorf, and I've known Kent and his lovely wife, Lori. We've met at a couple of the health and wellness shows like A4M and RadFest, and they have a company that is called Integrative Peptides, and Kent, welcome to Ageless and Timeless, and just wanted to be sure that we say the right thing. But are you the founder and CEO?
Yeah, yeah. I'm the founder, no longer CEO. I stepped down from that.
Okay,
Thank God. But yeah, it's been so wonderful because I've seen you for so long at all these, amazing conferences,
I
and
know.
so I thank you so much for having me.
Well, not only that, but I've been using your products for 2 years now, so I can be a great spokesperson, and I will be today when I.
I did not know that. Thank you.
Oh yeah, Lori took good care of me. She got me all stocked up, and I
She does
have.
that.
I even have the one that you're supposed to put on every day for the pets, but you're not a pet. But Lori said you can use it as.
Oh, yeah. Well, so our peptides,
Yeah.
and people use it on their pets, and then found that it's a wonderful facial cream.
Oh, that I didn't know.
And we have a Mexican hairless dog, and we're rubbing on our skin because she needs, like, some sort of barrier. And then she
Yeah.
started growing hair.
Oh.
So, and it was like tufts of hair. It almost looked like plugs, so we had to stop. But yeah, it
Oh.
was growing hair. But
So
and she'll
would it be good to put it on right on your scalp?
Yeah, I can't say there's any studies. There is on the, in the ingredients, but there's no studies on that product for growing hair.
Yeah.
But an N of one, the dog,
Yeah.
Cleopatra,
Yeah.
grow. But yeah, Lori will grab people like walking out there limping, or someone in a wheelchair. Hey, come over here, and just give them peptides. And so
Yeah.
you come back the next day, and I swear the testimonials are amazing.
Well, I know that, and I'm one of them. So, yeah, that's one of the reasons I wanted to have you on is because when I try a product, and I'll keep using yours, and I'm kind of running low, so I'll talk to you about getting some more. But when I try a product and it works, you've got me sold because there are so many dead ends, as everybody knows. You can take lots and lots of different supplements and never see results, but well, you're in the middle of an industry that's one of my favorite topics, and that's peptides. So we'll get into the two different categories of peptides that. But I wanted to let you know that I now write an article monthly for Top Doctor magazine, in addition to Ageless and Timeless. And my first issue of Top Doctor was Jay Campbell, and he is now the founder, one of the co-founders of Peptide Bio Longevity Labs, which is they're focusing on peptide bioregulators as well as other peptides. So I guess you would say they're a competitor of yours, but a friendly one.
You
And
know what? There's no competitors. It's it's
yeah,
it's like being on a restaurant row. It's building
yeah,
awareness, and as long as they're not doing crazy crap and
yeah.
bringing everyone down, there's no competitors.
Well, the thing is, you get your products from one of my favorite people in the whole world, and that's Phil Mickens. And I think are you still working together with
Oh
him?
yeah, we love him. Yeah, that's all our bioregulators, because the
Yeah.
thing is, it's very difficult to test any bioregulators. So you have to really go by the manufacturer and the studies that they've done on that product. Because anyone can say, here's a bioregulator, da, 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 right?
Right.
Because it's natural and you can't test it. So
Right.
yeah, that is why, Phil is just awesome, and they've been
Yeah.
around. They've done the right things, and been connected to people like yourself and Radfest and all the
Right.
things. So yeah, it's about
Well, he was one of my guests on way before people really knew what peptides are, because I should say bioregulators are. And even though he had other peptides, the bioregulators is where we were focused. So I sent him a I think it was a PayPal or whatever of like for $2,300. That's how much faith I had in him. and now he actually is one of our sponsors for the podcast. So we have a very, very close alignment. And also, he introduced me to Dr. Bill Lawrence, who is the protege of Dr. Cavinson, who you know has passed away. But Dr. Cavinson is really the founder of peptide bioregulators, which have been in Russia for, I think, 60 years or so.
Right?
So,
Isn't it amazing? The most cutting edge stuff is 60 years old.
yeah, why is that?
And we find that with anything. And I tell people that if you have if you go back and review the last 20 years, you take 2 months and review all the medical literature in a specialty. It's not like surgery where you have to do something, but you would be a better specialist than a specialist. Let's say GI or neurology. I'm telling
Right.
you, there's so many great studies. All the studies now are manipulated, and they're basically the studies are published now. 50% are wrong. The conclusions are BS. Uh,
Yeah.
and that's the way the world is going, and something's got to change. So we'll see with RFK and all this
Well,
stuff.
I
But
was just going to say, I hope with the new regime that we have a change in that because so many people are fooled by these studies, and they never ask the question like, who sponsored these studies? You know, if it's a cereal company and they're touting processed foods and breakfast cereals,
oh
you
yeah,
should have a
and you look
quick,
at the COVID and big agriculture, it
yeah.
just big pharma. It's unbelievable.
I know. So we'll hopefully see some change there, right, Ken?
I hope
Well,
so.
so let's back up and tell us about your journey. You're like so many of us who had a health crisis and that really changed your life, but yet, as they say in the Chinese say, crisis and opportunity are synonymous. So in your case, what exactly happened?
Yeah, you certainly don't see that when you're in it. So,
No, sure.
growing up, there was always something weird. I was very functional, and happy, and but like half my body would be sweating, half would be freezing cold. My arm would stop working. My hands were so cold I couldn't shake hand.
Oh,
I thought, okay, no one could figure it out, but and no worries, it worked. And then went through college and got into medical school. It started getting something's going on. It just like so everything was so overwhelming. Like talking to a patient was just, oh my gosh, it was just overwhelming. So like
mhm.
anxiety, and people that have a kind of, it's kind of a brain fog, but just you can't help tolerate any stress, especially emotional stress or, psychological stress. And so I'm like, I can't do this. I'm gonna have to drop out. But I was very evidence-based. I'm still very evidence-based, but it is ingrained in you that anything alternative, integrative, functional is bogus. It means no evidence. I believe that. But, I went to all these top-notch university specialists like, well, you're just depressed. I'm like, I'm not depressed. I took your antidepressant, da, 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 didn't do anything because I'm telling you that's not it. And so finally I snuck off. I went to anesthesia because you don't have to talk to patients. I'm like, that's the only thing I could do, but I was circling the drain there. And went to these integrative, alternative conferences. I'm like, this is more evidence-based than the crap they're feeding us. And I'm just like, oh my God. So I left, started doing those things, and I just dramatic improvement. I wasn't 100%, but with thyroid optimization, which is, oh my God, it's number one. If you just do that with people, 80% people will get better. And some antivirals and mitochondrial boosting, and immune modulation. And I'm like, I'm great. But then I basically going through after residency and got out, and I went through a stressful divorce. Emotional stress is so impactful. People say, oh,
Well,
this is a stressed out woman, da da da, she's divorced. But what it does, people think emotional stress lowers immunity. It doesn't. It modulates it. So it lowers the TH1, so you
mhm,
can't fight intercellular infections or cancer. But instead of lowering everything, it raises that TH2, so you get all this inflammation,
mhm,
inflammation, aging, and that's where people are like, "Oh my gosh, you look terrible." So with that, and then I just crashed. I was bedbound, sweating, and it was, I was diagnosed, with chronic fatigue syndrome, which is a ridiculous diagnosis because they don't. It allows doctors to not understand or try to find the underlying condition. But I
mhm.
had Lyme, Babesia, Bartonella, and I could not get out of bed. And I was going to off myself and said, I'm going to give up. I'll give a year. I'll go in around the world. I could not. I went into heart failure. My heart was fibrosed because of high human transferrin growth factor beta, which is a key marker for so many people. Anyone with SEERS, mold toxicity, chronic fatigue syndrome, fibromyalgia, you want to check your human transferrin growth factor beta at Quest, not LabCorp, even though
Mhm.
they both are terrible. And Quest is the worst customer service ever. But there and it causes fibrosis. So my heart was fibrosed, and the cardiologist said maybe in 10 years you get 10% better. I could not stand up. I could not walk upstairs. And so I went around the country and the world, bent over, looking for treatments. And I was in Belgium and I did peptides. I didn't think anything of peptides. And then 2 days later, I just walked up the flight of stairs. I'm like, wait a minute. And then
Mm.
backtracked and oh my gosh, the peptides. And then so it took 2 years to bring them out to United States, and that kind of set things off. And spoke for TaylorMade, so they were big in bringing those in.
Yeah,
But
yeah,
it
because
changed my life, and it's changed patients' life. Every doctor we train on them has changed their practice, and yeah.
today's podcast is brought to you by International Anti-Aging Systems and Profound Health. The founder, Phil Mickens, has been a guest on Ageless and Timeless, and those who know him personally, as I am so fortunate to do, can attest to his knowledge, experience, authenticity, and his passion to help make the world a better place with a commitment to work profoundly to improve our health. I personally have used the peptide bioregulators, some of his hormones, and his skincare products, and I can attest to their efficacy. If you want those unique and value-added evidence-based health products, then IAS and Profound Health are your number one resource. We're going to flash on the screen the different websites that you can use in order to order their products. And no matter which website you go to and which products you order, please use the Ageless code for a 15% discount. Yeah, because you and I also share another person that we love in common, and that's Ryan Smith. And he was at TaylorMade, right? When you were
He's
having
got a
all
big
your,
brain.
yeah. So have you done all his true diagnostic testing now?
Yeah, yeah. So we totally use that, and we're going to be launching a longevity program where we're going to guarantee 5-year reduction in biologic age over 2 years.
Oh, when you say we, you mean integrative peptides?
No, Holtorf Medical Group.
Oh, that's your other company.
Yeah, so yeah, because it's a clinical thing. So yeah, integrated pep, we don't treat patients. Uh,
Right.
Supplement companies, so that's our treatment side.
Right. So, with Dr. Lawrence, you have to take the True Diagnostics test and the telomere test as the baseline before you can start in his clinical trials for the bioregulators. So he puts a lot of faith into Ryan and the company. And of course, now they've expanded so that you're not only getting your true age, biological age versus chronological, but you're also getting your organ age. So I'm
Yeah, no,
waiting.
I love how they expand. I mean, they're kind of algorithmic and biomarkers, but they all really hold up to scrutiny when you look at the medical literature.
Mhm.
And the big thing is methylation. The telomeres change much quicker than the methylation. And
Mhm.
then, but you add in, the biomarkers, and they're all valid. It's not like this one's good, this one's bad.
Mhm.
They all are different, but it's kind of a blend. So yeah, they all play a part. And Ryan's just fucking brilliant, and just bringing new stuff out, and whatever company he works for, it's amazing. So yeah, we're big fans.
He makes it look so easy. I told him when I saw him at the show recently, I said, Ryan, you've accomplished so much in just a year. And he's actually coming back on my podcast in next month, July 3rd, because there's so much has happened since when he first appeared. So he's like a whirling dervish.
Oh, and you know what? I mean, it is a great time to be alive. It's pretty crazy, but in terms of longevity in medicine,
Yeah,
great things are happening, but they're not in standard medicine.
yeah,
Standard medicine moves so slow. So
right.
the Annals of Internal Medicine showed basically published a review article showing that most doctors practice 10 to 20 years behind what's available in the medical literature.
Mhm.
And it takes on average a proven new therapy to get accepted into mainstream medicine,
Mhm.
17 years. okay,
God.
on average. And why is that? Well, one, doctors don't read medical journals. Okay, that's true. They say they do, but they don't. They'll if they even read the abstracts, they won't read them. But even more important is if you give them, here's 10 studies, 20 studies, 50 studies showing that here's a better way, a new, therapy or diagnostic criteria. They go, no, 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 no. My patients are different. I'm fine. My patients aren't like that. They're not evidence-based. The
Hmm.
most doctors are doing what they learned 10 years, 20 years ago. And
Hmm.
these are the experts. And,
Hmm.
and it's crazy. And they just poo-poo and they were adamant they're right. And the more adamant a doctor's right, the less they know. So, the really the where the action's happening is this integrative alternative space.
Yeah, I often say when I talk to people like you that that one talk that Peter Diamandis gave at A4M 2 years ago, he was the keynote, and he said in the last 10 years, we've accomplished more in functional medicine than in the last 100 years of medicine allopathically. So that right there says so much. And with all the technology available now and AI and like you said, DNA methylation and all these ways to test.
And but I'm telling you, it's like there's so many things against like forward-thinking doctors
Yes,
that if you are treating cancer and curing it, you'll lose your license.
yeah. Well, or escape to Mexico or some
Yeah,
other.
no, it's scary. So we have some mechanism like a private medical association and IRBs, but it's like you have to have a basically a war chest of money to fight them off because they will
Yeah,
come after you. And it is not because you're providing poor care, it's because you're curing people.
because you are curing people. I know it's well. Let's hope that this paradigm shift is going to occur with the change of the leadership. So okay, so back to where we were. So you discovered peptides by accident because you were in Belgium. You were desperate for a cure. You didn't know what you had, so you're kind of like you had blindfolds on, just stabbing for looking for answers that people were giving you all over the map, and most of them were wrong. But then these peptides, what peptides did you actually take in those first
You
two
know
that
what?
helped to change you?
And I don't totally remember because when you don't know what they are, I just like,
Yeah,
oh, peptides, you just take them like, what the hell was that I took? But I'm sure it was like thymosin alpha 1, like
yeah,
4,
yeah,
BPC. But it's like, but then you bring them in, it's like, and there's so many. And all these studies are, again, 40, 50 years old, and you get into bioregulators, which we'll talk about, I'm sure.
yeah.
It's crazy.
I think most people don't realize that insulin is a peptide, and it was, that was around in the early 1900s, right?
Yeah.
So
Well, it's a protein because they changed the definition of peptide.
that's true. That's true. Well, let's go
But
into that definition so
but
people understand, because I
but you know
think,
what's interesting? Like nasal insulin is
yeah.
shown to totally benefit dementia and lower blood sugar, but they can't detect it in the blood. So
Uh,
it has some, basically activity not getting in the blood. So I mean, it's just amazing stuff. And anyways, that's kind of a side note.
Well,
But
last night I was watching Jay Campbell on a podcast, and I can't remember the name of the host, but they seem to know each other from athletics because this
I
host.
heard it was a Turkish bathhouse. They know each other.
Oh.
I'm kidding. I'm kidding. I'm kidding.
Well, wherever it was, they went through every single peptide to talk about what they do, what their benefits are, and so forth. And I thought, and it was because I was going to have you on here today. And I thought, well, if we ever did that, we'd be here all for 24
Oh
hours.
my God. It is. It just and also every month there's more and more. And you
I
go
know.
back and then the farther you go back and they're great studies, even better studies that are older studies. People are like, oh, I didn't want this latest year. Yeah, it's just, bogus. But
Hmm.
yeah, it's just incredible the amount of literature that is out there that is actually it's basically suppressed or ignored, I would say.
Well, I mean, we know there's 21 bioregulators, but how many peptides are there of
Well,
the
there's
synthetic?
there's actually 34 bioregulators.
Oh, they've gone up. Okay. Well,
Well, we have 14 of them that no one else has. But we have like mitochondrial bioregulators, stem cell bioregulators that we
yeah,
should be out
yeah,
in the next month.
I want to hear about that. I know that that's something that's brand new. But so how many other peptides, the original synthetic injectable peptides, how many are there that are
Oh, I
available?
mean, there's thousands of those.
Oh,
And the thing is, it how commercially viable are there? They're like, look at Clotho. Oh my gosh, it's amazing. But it's a very complex molecule. It's so expensive to inject, and I mean, it's totally anti-aging, anti-inflammatory, but it's going to cost you, $3,000 a month to do.
mm-hmm,
So it's that spectrum. So there's so many. I mean, they can synthesize any basically peptide in your body now,
mm-hmm.
but just doesn't make sense. Yeah.
Well, so I know that you have been very gracious about giving us a little graphic presentation, and Tony has your link, so he's going to show that. Just tell me before we get into the graphics, let's tell everybody the distinction between peptides and peptide bioregulators.
Awesome. And so people say, well, what is a peptide?
Yeah.
And people think of like, collagen peptides, and they are peptides. So a peptide is amino acid, and people are used to proteins, which by arbitrary definition, if they're greater than it was 60, then 50, then 40 amino acids, it's a protein, like insulin, which now is a protein.
Mm-hmm.
But it's less than that, it's a peptide.
Mm-hmm.
And most of the peptides work basically, they go on the cell surface attached to a receptor. Then they have secondary effects and secondary signaling molecules, very pleiotropic, very much like kind of supplements where multiple effects. So they may increase an enzyme, block an enzyme, or a change metabolic activity of the cell. Now, bioregulators are a subset of peptides. There are only 2 to 4 amino acids in length, so very small. And what they work very differently. So they'll go into basically, they're very orally bioavailable as
Yeah.
long as they're like, if you take them as a salt, let's say an arginine salt, like BPC salt, or what's called stable BPC, should be unstable BPC. But and let's say it's capped, and the body will acetylate and amidate. They'll cap any peptide that is important so it doesn't get broken down. So these peptides we cap them, and then so they get into the system, very high bioavailability.
Mm-hmm.
Then they go into the blood, then to the cells, inside the cell, then into the nucleus, and bind to repressors and activators of genes. So they work epigenetically.
Mm-hmm.
They turn genes on and turn genes off.
Mm-hmm.
So they work very different than attaching to the cell surface and activating a pleiotropic effect.
Yeah, so they're tissue specific or organ specific, whereas the other peptides, the original ones, eh, they just go anywhere, right? I mean, they're
And yeah, and they tend to be, yeah, very much more specific than hormones or peptides or supplements or medications. If you take it from the thymus, it will work on the thymus gland.
Mhm.
There's certainly some crossover, which is good, but they'll tend to focus on that epigenetic. They'll turn which thankfully, the basically anti-aging genes, and they'll turn off the sick genes, the sick phenotype.
Mhm.
And they basically also, it's good, as you get older, you stop producing, basically the cells stop, they get lazy, and
Yeah,
they stop producing protein. So
yeah,
it's one of the hallmarks of aging that you don't make as much.
yeah,
And so we'll turn that back on, like mitochondrial function. And basically, so turn those on in a tissue specific way. So if you need the liver to function better, da da da. And so it starts functioning better as it was when it was 20 years old,
mhm.
or the heart and reverse heart disease. And it's just amazing. Or fertility. Oh my gosh, we're doing just amazing fertility stuff. It's
Mhm.
anti-aging the ovaries and the whole system. And when you come now, when you stack those bioregulators, that's where you get the real power.
So what, for example, take BPC 157, which is probably the most popular or well known of the traditional peptides, not the bioregulators. But if you took that and you were going to stack it to go after joint or tissue injuries, what would you stack it with?
Yeah, and so there's so many different ways. And with BPC, it's so great. And people think of it as a gut peptide because that's
Yeah,
where it is produced.
right,
And for instance, if you add BPC and KPV, which
right.
is a tripeptide of melanocyte stimulating hormone, and it happens to be hugely anti-inflammatory, but it doesn't suppress the immunity, right? Everything anti-inflammatory suppresses immunity, and it's antimicrobial, so it's more potent than basically diflucan against mold, and basically the typical antibiotics against like toxic Staph aureus. And it's lowering inflammation and boosting your immune system. So, and it also works on on the gut lining. So BPC will rejuvenate. Everyone has leaky gut. They're
Mm-hmm.
allergic to all this stuff because all the toxins. And then you add, for instance, TB4, so thymosin beta 4. It
Mm-hmm.
goes to wherever there is damage. And you look at, let's say, COVID patients that are in the ICU, they they don't have any TB4. The body, the virus suppressed it, and a big reason they're finding is that the lung cells can't secrete TB4 to rejuvenate. And they found that giving that, but it rejuvenates all the tissues. But the big problem is because normally, if you need to heal something, basically all the mast cells need to be activated to go heal. But we have so many people with chronic illness that have mast cell activation syndrome, chronic inflammatory response syndrome, chronic fatigue syndrome. Their mast cells are already totally activated. So if you take TB4, you're activating all the mast cells because it is a multi-domain 143 amino acids. But TB4 frag does basically the immune modulation of TB4 and the healing, but leaves out the bad parts for most
Mm-hmm.
chronic illness. And you can stack all those things like BPC, TB4 frag, and TB4 frag specifically will target the tight junction and heal those in the gut. And then you get KPV. We've had so many people with Crohn's that are coming in like a 12-year-old kid with they want to take out their colon and they're so quick to do that. We're like, no, 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 because they failed all the other treatments. And within, a month, 6 weeks, they're totally fine.
So with the BPC 157, if it's for the gut, isn't it better to do it orally? But if it's for the joints, it's better to inject it and to try to inject it right into the site where the trauma is.
Yeah, so people say, oh, oral peptides and they don't absorb. They're right for the larger peptides and even maybe the smaller peptides if they're not capped. But studies have shown, for instance, BPC, if it's capped, acetylated and amidated, and that's what they do at integrated peptides, that it is equal potent. Every study has shown equal potent to basically sub-Q, IM, even IV. It's equal potent. It gets the exact same effects. Now, if you have a joint problem, you inject it in the joint, yes, that's going to have more effect inside the joint.
Right. Okay. So, in your personal case, which would you, if you had to make a choice, would you take a course of bioregulators before peptides, or would you combine them, or how would you, make your selection for something that's a vast array of possibilities?
Yeah, I mean, I think the thing is the stacking and combinations is so powerful. And I'll even we see for all my sins, I guess, all this the sick of the sick, right? That have been everywhere and multi-system illness, and we should try to see healthy patients. I've not seen one, but I'll often prescribe 10, 12 peptides and bioregulators together on the
Mhm,
initial visit,
mhm,
based on their symptoms. And then the lab's always supportive. I've never had an issue with that. Because the side effects are so low, right?
mhm,
And because they all really are so synergistic that and the problem is I can give you 1,000 supplements that are good for you, but which ones are going to make a difference. The difference is that they do make a difference.
Hmm.
And people say, well, how do I know is working if if I take all those? Well, when you feel so much better, then we'll figure it out. Then we'll drop them, right? So we just
Hmm.
drop one at a time. But usually, because what you find is if you do, let's say, bioregulator A, or and then peptide B or a bioregulator C, you do one at a time. Oh, I didn't really notice anything. You do them together. Oh my gosh, I feel so much better.
Hmm. So do you actually formulate them when patients come in, then you just interview them, look at their labs, and then you come up with a customized peptide program that that is, obviously collecting the or stacking the peptides like you said. Is that how you
Yeah.
go
Oh
about
yeah.
doing
My problem is I love seeing patients and I'm not very financially sound with it. And I'll spend 4 hours with patients
it?
and
Yeah,
like, yeah. And I can't understand how doctors are spending, 10 minutes,
50.
20 minutes. Like
I
I can't
know.
say hi in that time.
I know. It's that's part of why our healthcare system is so broken. Is the insurance companies are mandating these, abbreviated interview times. How could you possibly get to know a patient's needs in a 15-minute
Yep.
discussion? It's
Yep.
ridiculous.
And
So, all right. Well, let's talk about, and then I want to make sure we have time for the slideshow. So, in the slideshow, this was your talk at A4M. Is that what we're going to see? And
yeah,
your
yeah, we kind of combined the just a few slides from A4M and Bradfest. Yeah.
Okay, so would this be a good time to do that, or would you rather
Sure.
go deeper
Sure.
into some of the conditions that people are going to be treating?
Yeah, that sounds good.
We'd rather do the slideshow now. Okay.
Yeah.
All right. Are you want to do it, or do you want Tony, our production person, to do it?
Oh, I don't know if we can put it up from here. I don't know how.
Okay. Yeah, it's usually on Zoom, but Tony, are you there?
I am.
Okay. Can you go ahead and put the slideshow up so Kent can? There we go. So Kent, do you want to talk about what these are?
Yeah, so this is basically the thymus activity with age. Was it so small for me? Um,
Tony, we lost the
uh,
slide.
no, it's okay. I have it.
Oh,
So what this shows is through the ages that the thymus totally involutes. So it's right here in the breastbone, and the
yeah,
thymus controls the immune system.
yeah.
The you okay?
Mm-hmm.
Oh, the Th1, Th2. And again, any model of the immune system is an oversimplification, but this works for clinical. Th1 gets stuff inside the cell, Th2 gets stuff outside the cell. You can add Tregs over here and Th17, which causes autoimmunity. So as you get older or sick or stressed or toxins or whatever you're exposed to, that Th1 goes down and the Th2, Th17 goes up. So now you can't fight infections, you can't fight cancers, but now you have all this inflammation, all this autoimmunity, and all these symptoms, neurodegenerative disease, and it's like this. And as you get older, that you can tell how old someone is by their immune system and what likely their multi-system illnesses are. So, but if you and people, so that all these studies showing that, oh, we're going to rejuvenate the thymus, giving growth hormone and metformin and but why not just give thymic peptides? We've been doing
Mm-hmm.
it. It's so safe, you can't overdose, and you just modulate it. So you raise that Th1, lower that Th2, and then lowering the Th2 is BPC
Mm-hmm.
157, KPV, and now you raise that Th1 with like thymogen alpha 1, which is Vilon, which are bioregulators,
Mm-hmm.
and the thymus. And now you modulate those, and all of a sudden, all that vicious cycle of aging and chronic disease, where you get hypothalamic, pineal, pituitary, basically hormone levels are low. You get mitochondrial dysfunction. You can't detoxify. You get low hormones, and it's just a vicious cycle. But now it unravels, so it goes the other way, and now you become a younger phenotype instead of being that age phenotype. So the things that work for that are the thymic peptide. So instead of trying to rejuvenate the thymus, just give the thymic peptides. It's kind of like hormone replacement, right?
Hmm.
And they're cheap and safe. You can't overdose. And with that, and now we should probably talk about bioregulators at this point because when cavacin and yeah here, so yeah, let's kind of take a step back, and so how did these kind of come about? So the during the Soviet Union, they found that their fighter pilots, their cosmonauts, their submariners, all were aging dramatically fast. Like, what's going on? So they went to the KGB hospital and they talked to Cavison and Pavlov, as in Pavlov's dog.
Hmm.
Same guy. And they're like, you need to fix this, or we'll see what happens. They're like, okay, we will fix this. They must have been doing because Pavlov was doing studies on basically extracts, and they found that the extract from the thymus and the
Hmm.
pineal gland, right in the middle of the brain, which it's that eye, basically totally reversed their rapid aging.
Hmm.
And they're like, okay, awesome. And but no one knew. And so it was a Soviet military secret, only given to the military and the Olympic team. Olympic team did pretty well, right, during that time.
Hmm.
And then with the fall of the Soviet Union, they all of a sudden they started publishing, but it's in Russian. Who's gonna read it, right?
Hmm.
And so like 40 years later, like, damn, look at this, they translated like there's some interesting studies. So it
Hmm.
started getting more noticed and they started publishing in English, and that's where it basically started taking off. And
Hmm.
like we've hired a Russian researcher so we can go dig into that stuff. But it's really interesting how it was a Soviet secret for a long time.
Hmm. Yeah, well, they could in the Soviet Union, they could buy them in drugstores. I mean, they were
Oh yeah,
readily
and
available, but they would not let them go be exported. I guess I think maybe with the Ukraine war, it's only become more difficult for the supply chain. But they have now made an aggressive, this is again tribute to Bill Lawrence, who went and knocked on their door and said, "Hey, he had his own uh, health crisis, as not as bad as yours. His was more like a genetic thing, where the age of his relatives were all mortality rate was in their early 70s, and he was already 73. So he said, I don't want to die. I want to find answers. He gave up his real estate career and got his PhD, and the rest is history. But, to his credit, he went and knocked on the St. Petersburg lab, and they took him in, and
oh,
he
I
became a
mentioned.
protege of Cavinson. So he's really responsible for the first iteration of those bioregulators coming to the U.S. Now they're, obviously with people like you and Phil and others like
Yeah, I
Jay
mean, the
Campbell.
problem is our last shipment got seized and sent back.
Really?
Yeah,
Oh, even through Phil, because he said he was trying to set up a
yeah,
distribution facility in the U.S.
yeah. If something works, they're gonna try to block it.
Oh, that's really sad. Oh, I'm sorry to hear that. Okay, so that was slide one. Tony, do you want to do the next one?
Or can you go back? I think there was a thymus.
Oh, okay. Let's see if he's still here. Are you with us, Tony?
I am.
Okay. Can you show? I guess Kent wants to see that slide
There was
again.
this real quick
Let's see.
previous slide.
Previous slide. Let's look at this right here. Is it that one?
Yeah, go one up, one more up.
Yeah,
Okay.
the original one you showed, Tony.
Oh, okay. So let me get that for you. And I can edit this out, by the way.
Yeah, we won't have all these hits and starts.
I have
All
It
right,
that.
was
we're gonna say. I thought there was one in between. Yeah, so
Yeah, there was a graph one that
yeah,
we
yeah.
started with. That's all
Go
right.
ahead.
Okay,
Go
just
ahead.
go to the one you're on, Tony.
Yeah, go ahead. Sorry.
That's all right. We can go back to that
Oh,
Yeah.
there. Okay, let's
So
start. Let's go with that
yeah.
one.
So even the CDC acknowledges that 80% of aged adults have at least one chronic illness due to the involution of the thymus.
Mm-hmm.
why not just give people the pennies a month to fix that? And now,
Yeah,
just think if you just remove one chronic illness per person,
yeah,
how much would that be worth, right? But they won't.
right.
Yeah.
And billions of dollars of healthcare costs to all of the taxpayers, plus
Yep.
the wellness and the attitudes of healthier people that make a much less divisive world, a happier world. I mean, that people
Yeah,
don't often get
that's
into
that's a good point.
psychological.
I never thought of that little subtlety there. Yeah, that was.
Yeah, no, it's true. I mean, you know, when you're sick, the
Oh,
world looks very dark and bleak,
you
and
don't want to talk to anyone, like you
you don't
snap.
want to talk to anyone. You don't want to, you know, and then there comes the whole psychological side of that. You start giving up like you almost did. Thank you
Oh
that
yeah,
you did.
I was gonna off myself. Yeah.
Yeah, you were gonna, I mean, that's pretty extreme.
Oh, it's
So
horrible. It's, and people have chronic Lyme and chronic inflammatory response syndrome. It's horrible. No one realizes how freaking bad they feel. People are like, oh, just exercise, eat better. You want to kill them.
yeah,
It's horrible, and they
well,
are suffering more than you know.
and
Yeah.
they always say stress, you know, oh, that's like the catch-all, you know, if you're just stressed, you have to go meditate more or whatever, do
And
yoga, but you
and
feel like crap.
oh, and
So
the people, like in general, people can be empathetic for about 2 to 4 weeks.
right,
And then they're like, come on, get out of fucking bed, and
right.
it's true. It's tough.
So in the bioregulators, there's one called thyme. What's it called? It's a Russian name, but it's the thymus
Yeah,
bioregulator.
yeah. So if you look at what really is the core is the thymus and the pineal gland.
Pineal.
Yeah, if you want to throw up the slides, I think it talks about that. But and then if I had to throw another one in there, and I know Natalie Needham, we agree on this,
Yeah, yeah,
is the vascular,
yeah,
is the blood vessel,
yeah,
which will actually reduce the inflammation in the blood vessels.
yeah.
So now, as people get older, that basically doesn't work, and they get, stiff vessels, so they get hypertension. It starts collecting, calcium plaque and gets stiff. So it actually reverses that. And it also basically is a cinemorphic so that all the SASP, like all the inflammation, it
Mhm.
tamps that down. So it has multiple ways and it also boosts stem cells. So it adding that to everything is shown to work better. Like the studies on, for instance, in our Cogdipep, where we have the cortexin, the pinealion for the brain, but you add the Vasugen, which is the blood vessel, it just works like 4 times as well.
And so, this is really important to go over the conditions that are obviously being addressed by the peptides, both peptides and peptide bioregulators. And so I think one of the biggest ones in our world today is the microbiome and the gut-brain axis. So would you talk about that for a moment and tell us, what your suggestions are for people who are trying to
Oh yeah,
affect?
the gut is so huge, and we have all these, forever chemicals and toxins and pesticides and plastics. It's just glyphosate just ripping the guts open,
Yeah.
and everyone has leaky gut, so allergic to everything. All this autoimmunity is just going rampant, and so it's nuts. So you got to really heal that gut lining. So BPC is key for that. Again, I mentioned that TB4 frag will focus on the tight junctions. And some people will give like BPC because it's arginine BPC, a stable BPC. It doesn't absorb very well because it's very polar. They give SNAC with it, which is it basically increases absorption, which is banned in Europe, and it breaks open the tight junctions.
Mm.
So you're giving something to heal the gut, but you're breaking up the tight junctions. It's like,
Wow. Oh,
um,
wow. So that's creating more leaky gut.
yeah, and so it's like, and they're like, well, it's shown to be safe, but it's the government did the study saying healthy people will heal, but they don't have anyone who has chronic illness at all.
Right.
And then so we have like with gut feeling, which we have the BPC, KPV, TB4 frag, Akkermansia, which is a probiotic which is associated with health and basically lean muscle and like we're destroying our microbiome with all this stuff too. And there's so many toxins that are additives that just kill the microbiome.
Hmm.
And so, and you look at, studies for dementia and heart disease, really correlates with the microbiome. But you have to, like BPC will help heal the microbiome so you can actually naturally put all these things together. So, but I'm really a big fan of, basically healing the gut, adding, all these the keystone probiotics, where kind of standard probiotics just go and they're gone. But you want keystone that basically and they're spore based, so they're there for a long time and they build that community.
Yeah, I think people forget the most important thing about probiotics is they 90% of them never get to where they're supposed to be because they can't get through the acidic gut barriers, and so you have to the spore based at least are being scientifically shown right to
And
survive.
what is interesting too with acromantia is dead acromantia was shown to have better effects than live acromantia. But then you look at, downstream, there's not great studies on that, but and so because it shows that it is a receptor mediated phenomena. So if you have acromantia, it attaches to the receptor and has the immune modulatory and the gut brain axis modulation. So we add, basically, tons of the dead and alive.
Yeah, and Adam Perlman was on my podcast, so I buy a lot of I buy the only Akamansi I bought is through Pendulum. So are you familiar with them?
Yeah, yeah, yeah. We talk to them all the time.
Yeah, so you use their product as well?
Well, we have our own, but
Oh, you do? I didn't know that.
yeah, well, it's in our gut feeling. Yeah.
Okay, okay. Well, I should recommend. Okay, well now I know that. That's good to know for the future. Well, but Akkermansia has become the darling of the gut.
Yeah, and then you look at, reutery and
Mhm.
basically showing for dementia and aging, and there's so many things that this basically bacteria in your gut will prevent X, Y, Z, and they're
Mhm.
getting so much better at that.
So probably the first thing that people think about for ailments is the microbiome. The second one is obviously Alzheimer's and brain uh, dementia and brain deterioration. So it sometimes morphing to Alzheimer's. So Dr. Bredesen, another one of my prior guests, he says, Alzheimer's is a curable disease. So
Absolutely.
why do you feel that way? What
Because
can
we've
be
seen
done?
it. ALS, curable disease. We have
Mm.
patients coming in wheelchairs, they're jogging. They go back to their neurologist and they say, "Hey, I'm cured." Like, well, you must not have had ALS because it's incurable, so it must have been misdiagnosis. Three of you, okay?
Hmm.
Alzheimer's, totally normal. We see it all the time.
So what's the protocol for getting those cures?
Yeah, no, the protocol we do kitchen sink. But yeah, Branson's part is 10%. Yes, to do it. But I'm a little ADD for that. I want, action. And for instance, this doctor, this at ALS, who was a mentor of mine many, many years ago, has ALS. And I'm like, let me just try to put together our protocol and I'll summarize it for him. I ended up with 500 slides sending him.
Oh, wow.
So yeah, to show you like what's the protocol? They're like people are like, what's your Lyme protocol? And
Yeah,
it's like, oh, that's a
yeah.
thousand slides. But yeah, and but it's we're trying to develop the basically the algorithm and protocols. So because so many doctors can do it instead of like giving them this little bit. Because
Yeah.
our basically our model for our center was I would train doctors for 2 years, then we could treat anything, really anything that came to the door. I'm telling you. But I can't get doctors to do it anymore.
Mm-hmm.
They don't want to spend the time. they don't seem to understand concepts. They want to memorize. They want an algorithm. They want to leave from 9 to 5. I don't. It's a different world, I guess.
Hmm.
So I'm starting to realize that. So I've always hated protocols because I'm like, everyone's individual, but
That's
I
true.
love protocols. Doctors love protocols. So I think maybe it's not totally perfect and not optimal in this, fantasy world,
Hmm.
but I'm going to just do protocols for everything, and it's going to be 80%, as good, but we
Hmm.
can treat so many more patients.
Right. But I mean, in a protocol too, it's a baseline that you can build.
I like
It's
that. You
like,
know what? That will make me sleep at night.
yeah, exactly. No, true. I mean, it's just like the BPC. I mean, you're starting there because you know that has this impact, this efficacy, but then you're stacking with these other peptides or peptide bioregulators that are going to be specific, customized to that particular patient's
I,
needs.
I really like that. Now I can like live with myself.
So,
Because I'm always like, God damn it, you got to be like, custom, totally custom. But yeah, if you can help 10 times more patients and be semi-custom, probably a good thing, right?
absolutely, that's what is missing, I think, in most in the allopathic practice is a customized approach. It's sort of a one size fits all.
Well,
Here,
I
let me
have to
give you.
thank you. I feel better.
Well, I mean, they reach into their pocket. Let me give you a prescription for XYZ, and then you're gone, and now you have all these side effects from that.
And I'm sure you've seen it's like care is so freaking barbaric.
Yeah,
I mean, for diabetes, they're just like, they don't treat them, heart disease, or they like, well, okay, yeah, you may have a stroke. We'll wait till you have a stroke and then we'll treat it. Like it's
yeah,
just
I know. So before we get cut off, because the time is running out, and I know we didn't get through all your slides, but I
no
apologize.
worries, no worries.
I knew this would happen because you have so much knowledge and there's so much to talk about. But before we leave, we have to talk about the semiglutides because they've become such a big thing, and there's so much pro and con. What's your position on GLP-1?
I think they're great, but anytime you try to extrapolate a drug, a medication that, for, let's say, for diabetes, now you
Right,
say, oh, it's for everyone, let's put it in the water. You're going to
right.
have side effects. You are going to have negative outcomes. And then
Hmm.
people are just like, oh my God, it's the magic thing. And it's going to exponentially increase side effects. So it's like, yeah, and we always try to think, oh, this is good, this is bad. And even like, or I always think about people are doing all this aesthetic procedures, right? They
Hmm.
think there's no downside. I've seen
Hmm.
so many bad things happen
Hmm.
with that, and they don't realize there's a downside. There's a downside to all these GLP-1s. In the right selected patients, exceedingly safe, and then at low dose, if you stick to low dose, great benefits for reducing dementia and depression and metabolic health and all that. Now you
Hmm.
start ramping it for I want 20 pounds and 30 pounds of weight loss a month, you're going to
Hmm.
have issues.
Exactly. Yeah. So Elizabeth Urith, Dr. Urith from
So
the
she's
Boulder.
great.
Yeah. So she said 2 years ago, I think she was my guest, and she said, she even uses them, but she doesn't need to lose weight, but she does it for those other benefits as well as just the keeping her weight in control. And she said she microdoses.
That
So
that that is going to basically shown to be the way to do it. It has so many more benefits. The risk benefit is dramatically, or the benefit risk is dramatically increased at low dose. As you go up, it starts reducing.
yeah, and then combine it with ipamorelin because of the sarcopenia. So can you talk about that for a moment?
We're just put out is the GLP-1s and follistatin. You,
Oh,
you know follistatin, so
no.
yeah, so when your body is actually older or stressed or inflamed, your body makes myostatin. So myostatin keeps your body from losing weight losing fat or gaining lean muscle.
Yes.
So the follistatin blocks the blocker, blocks the myostatin.
Oh,
So it is, I can't believe people aren't abusing it. Actually, bodybuilders are, but
yeah.
it's probably 10 times as potent as a steroid, and it's good for you.
It won't have side effects?
Well, everything has side effects, so I can't say
Yeah.
that. I'm just saying in general,
Yeah.
all the things that it does are reduces inflammation. It
Yeah.
actually, increases sirtuins uh,
Yeah.
and that, and shown to be exceedingly safe because like you can do 10 times the dose, but you don't need 10 times the dose. So
Yeah.
you'll not only keep your lean muscle, you'll gain lean muscle. If you
Mhm.
work out, even better, but you don't have to. And then you add the GLP-1, now you're
Mhm.
losing body fat, and you combine the body fat loss, which people they lose all, muscle and fat in
Mhm.
in the
Yeah.
face, and they lose
The
muscle,
Ozempic face.
which yeah, and which also I want to bring up is that if you diet more than 3 cycles, and these studies by Lyle and others, that if you diet more than 3 cycles, your metabolism drops, your thyroid level drops, it's a hypothalamic pituitary TSH axis. So the TSH drops, so it looks you don't know you're low thyroid. Thyroid
Mhm.
level drops, your metabolism drops, and your body, it tells the body to store fat. And
Mhm.
if you even go back to normal eating, it doesn't go back to normal.
Yeah.
So when people say I've wrecked my metabolism, they have.
Yeah.
And so we'll check people because the blood test, well, we can pick it out, but the standard blood test, they'll say, oh, it looks fine. It tastes just fine. People are like, my God, I can't lose weight. I'm
Mhm.
cold. My hands are cold. I know,
Mhm.
but, and then we'll check their basal metabolic rate, how many
Mhm.
calories they burn per day. They're generally 25% lower than someone their same age and body weight.
Yeah.
So they're like equal to someone who's, basically 50% less weight. They have no metabolism. Unless you give something to boost that, which is generally T3,
Mhm.
T3 thyroid, or mitochondrial boosters can also work, or the thyroid bioregulator, the thyroid
Mhm.
axis bioregulator, that it's so hard to lose weight. Because the
Mhm.
more weight you lose, the lower your metabolism goes. And
Correct.
so you can never catch up. So
Correct.
people say, I would say 70% plus of people have low thyroid, even
Correct.
if their doctor says they are fine. And
Right.
it causes so many problems. Yeah.
It's one of the most underdiagnosed conditions in our country, I think, and probably in the world. But at least here we know that because they do it by the blood work, and then they don't do the full complement of testing. They only do the TSH, or and they're not really looking. They look for T4 as to give you Synthroid or something instead of the T3, which really is going to help you to have a
And you know
better.
what? And they don't understand physiology.
Yeah.
And because what happens as you get more inflamed, you get older, you get sicker, the TSH drops and the
Yeah.
T goes up, right? So that is a marker for high thyroid for doctors,
Hmm.
unknowing doctors, but the TSH drops because of the inflammation.
Hmm.
And then the T4 basically goes up because the body, the mitochondrial dysfunction, because uh, almost every endocrinologist thinks that whatever thyroid's in the blood diffuses into the cell. Doesn't
Hmm.
happen at all. It's
Hmm.
active transport, so it requires energy. And the T4 transporter actually requires more energy than the T3. So the T4 transporter, it basically doesn't work because it needs energy. So the T4 goes up in the serum because it's not getting into the blood. So you have low TSH, high T4, and they're like, oh,
Yeah.
you're high thyroid.
Yeah.
Oh my God, it's the wrong thing. It's so
Yeah.
low. And then their free T3 is super low and their reverse T3 is high. And you
Yeah.
give them thyroid and their life changes.
Yeah. Exactly. Yeah. So, okay, before we have to go, you've been so generous to offer to let our viewers have an opportunity with a discount to try some of the integrated peptide
Yeah.
products. So, why don't you tell us how people can reach you and what that offer is and what the code is that they need to use?
Yeah, sure. I have some pull over there somehow, but I guess so. I was told 20% off IP products if you go to integrativepeptides.com
And
and
that's with an S. Peptides.
Thank you. I'm kind of slurring. The silly, sassy, whatever. And then you plug in Ageless 20.
Yeah.
Thank you.
Thank you.
And you'll get 20% off your first order there.
And
ask questions and all that. Yeah.
Yeah, and is it www.integrativepeptides.com?
Yeah. I know someone's just telling me 25%. I guess they just got up to 25%.
Oh, wow. That's
now, do they plug in Ageless 25 or Ageless 20?
Ageless 25.
Ageless 25.
Ageless 25.
For the people that stayed on, for they just got the 20, but if they hung up, they don't get 25.
Oh, well, too bad. No, but we'll have it in the show notes. So, and then they can get your ebook. You wrote an ebook on peptides, which I think everybody should read that. And
it's so the peptide protocol for the rapid treatment of SIRS. Most people don't have SIRS, chronic inflammatory response syndrome, but there's so many people with chronic illness, and we're coming out with a new version. And adding, the bioregulators aren't in there. Someone stole it off my desk and published it, honestly. Because I never finish anything, right? Everything I just keep wanting to add. So I have like 10 books that are 90% done. So I'm glad she did. But where can they get that?
We can't provide a link for them.
Where?
We'll send it.
On her site?
Yes.
Yeah, I think I saw it.
We'll somehow send it.
Send it to us, and we'll get it into the show notes, okay? Well, Kent, as you can see, we could have gone on for 2 more hours easily and had still not run out of subjects to talk about. There's so much that we want to cover, but I think we got the highlights and the things that people are, at least the most frequent chronic illnesses that people are addressing in their lives. And of course, there's so many others, but this was a big help. And also, the other thing that you did today, which distinguish between bioregulators and regular peptides, which I think people get confused about. So thank you for clarifying that for everybody.
Awesome. And I assume I'll see you at RadFest.
I'm going to go to this new one in Chicago called Biohackers World. It's brand new. Well, it's not new, but it's new to Chicago. So I'm not sure about RadFest because I get back like right as RadFest is about to begin.
Well, I thought you were the RadFest queen there.
Not at all. I just had James Stroll on my podcast, and he invited me last year to come and join them. So that was my first time ever to attend. But Bill Andrews has been on, and James and Jim LaValle, all the guys that are active in that group. So I may not see you there, but I'll see you at A4M.
Sounds good.
In December. So
thank you so much. Keep up the wonderful work.
Thank you. Awesome. It's really important to me what we're doing. And now this Top Doctor magazine, the monthly column I'm doing is adding to the protocol of being able to help reach out to more people, to bring information like today.
Knowledge is key.
Yeah, I do want to order that product from you. I think that, what's it called again? It begins with the F, the one you just talked about. The
follistatin.
Follistatin. I was going to say fisetin, but follistatin.
Yeah, I'd like to combine that with the Ozempic or tirzepatide.
Yeah.
It's incredible.
Yeah, so Jay is sending me just as a nice little gift. Not that I needed to lose weight, but I like to stay metabolically strong. Is he sending me the Reatatrutide? Is that
it's the upgraded Ozempic and tirzepatide. So it works on another receptor.
Yeah, that's what I'm reading, and it's not nearly as many side effects if you microdose it, I heard. So, all right, Kent. Well, thank you so much. I'll see you in a couple months, 3 months or 4 months. Let's say June. Where are we? December. I'll see you in December.
Oh, it's scary.
I know. It'll go by fast.
Thank you so much.
Okay. Thank you.